starts now.
Money could be in the pipeline to improve rural health care across the region. Thanks for joining us at 5:30. I'm Kiana Burks. It comes as hospitals brace for deep cuts to Medicaid that the experts say could leave millions uninsured. Adam Sullivan reports from Littleton, New Hampshire, where Governor Kelly Ayotte gathered key stakeholders to discuss future funding.
The healthcare summit here in Littleton, New Hampshire focused specifically on rural care. Both the challenges facing hospitals across the region and a big opportunity on the horizon. On Littleton's bustling Main Street, which is home to the world's longest candy counter, I met James Harris. He recently had a health scare. He was getting winded while he walked, but he also worries about the pending cuts to programs like Medicaid, which were signed into law by President Trump in the, quote, big beautiful bill.
If they're going to chip away on things like that, then I'm not going to be able to afford it, and I'll be my own doctor, I'm afraid.
But additional health care funds are being allocated to offset some of those future cuts.
New Hampshire is set to receive potentially at least $100 million each year for a 5-year period.
$50 billion in the spending bill has been set aside for the Rural Health Transformation Program. That fund targets communities like northern New England, where access to health care has unique challenges.
To strengthen workforce, to strengthen the services that are available, to bring technology to connect to the larger areas is more efficient.
The Health Summit, hosted by New Hampshire Governor Kelly Ayotte, brought together industry experts, from doctors to mental health providers, to essentially help write the grant application the Granite State will be submitting.
And we want to make sure that we put the best proposal possible to Washington to maximize the opportunity to help support all of you.
And ultimately support patients like Harris, who isn't as winded these days after slight changes to his diet.
What else can I say? I try to live better, that's all. And it seems to have made a difference.
Littleton is just over 20 miles from St. Johnsbury. Governor Ayotte says she has spoken with Governor Scott about the issue as a way to find ways to possibly collaborate to improve care across the region. Reporting from Littleton, New Hampshire, Adam Sullivan, Channel 3 News.
New Hampshire is planning to submit its grant proposal in November. Vermont is also applying for the money, working on a similar timeline. Applications will start being approved in December.